now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to the Protecting Your Nest podcast. When I think about one of the most memorable times in my life, it was the moment I became a parent. It was almost like a dream. And even though as a family doctor, I've been involved with over 700 deliveries over my career, it was not until the moment my first child was born that I fully understood the love that a parent feels. Now imagine one day learning that your beautiful miracle is now facing a medical illness that they will struggle to overcome, and one that you as a parent will struggle with as well. How will you manage? How will you keep it all together? Well, today we will provide a roadmap because today we will meet a guest who has faced these same challenges, and she will share how she overcame them during this episode. Today's guest is Dr. Maureen Peterson. Dr. Maureen is a pediatrician with training in allergy and immunology, a life coach and author who specializes in supporting parents of chronically ill children. She is the mother of 3 amazing children and has firsthand experienced the struggles of having a child with long-term health issues. Dr. Maureen is also the author of a book by the title of Reclaiming Life, a guide for parents of chronically ill children. So I'm really excited to have her here and looking forward to this engaging conversation where we talk about how we take care of our most precious commodity. So thank you, Doc, for coming to this episode of the Protecting Your Nest podcast.
I am excited to be here and to have this conversation with you. I appreciate you for having me as a guest and appreciate your audience for listening to our conversation. Hopefully, they will learn something from the two of us today.
Yeah, well, I enjoy these conversations partly because I meet my new friends this way.
This
I get a
this is
chance,
true. This is
and
so true.
we just do it with other people,
Yeah.
So I think it's such a gift, technology and being able to learn from each other, and and not fall into the same rabbit holes that could have gotten us off path because somebody shares their journey. And I really think that's a great way to learn. Some lessons you have to learn yourself, but man, it's so nice to learn from others so we won't have to struggle in the same way. So I appreciate what you've done with your book, and of course coaching and obviously being a doctor out there, helping people that way. So let's get to know you a little
Sure.
better.
Yeah.
First of all, I'm in Chicago, so where are you at, and tell me a little bit about your family as well.
Yeah, sure. So I'm in North Carolina. Actually, just moved to North Carolina in May. So have only been here for the last 6-ish months, and it is a beautiful state. I can't believe I haven't been here sooner. Um, I, like you said, have 3 kids. They're all young adults now, with my oldest being in DC. My daughter, who we'll talk about, is in New Jersey. And my youngest is in Montreal, Canada, going to school at McGill.
Nice. Just for your sake, and some of my listeners already know, I had 2 kids who both attended Washington University in St. Louis. One is still in grad school, the youngest, and he'll finish next year. So I'll have 2 graduates from the undergrad and graduate programs. And WashU is in St. Louis, so it's not too far from Chicago. And it's fun to kind of be at this stage and to just maybe get to know your spouse again. So
Yeah.
it's a lot of fun. I'm looking forward to all of that, and life is pretty good right now. In terms of your focus on pediatrics, I kind of became a family doc because I wanted to know a little bit about everything. And I one of my favorite doctors at our clinic is also an allergist. He's for adults though. So I'm curious, why pediatrics, and then why specialize even further in the allergy and immunology space?
Yeah, so, I can remember as a kid uh, wanting to be a doctor, and not
Mm,
just wanting to be a doctor, but wanting to be a pediatrician.
mm,
I used to play the game of life, and I would hope that I would get the occupation card that allowed me to be the doctor during the game as a kid. Um, the when I went and did my pediatric internship and residency, I figured out how much I loved teaching. I loved
mm.
teaching patients about their asthma or allergies or atopic dermatitis. And I wanted street cred for being a good teacher. And so decided to subspecialize to really be able to teach. When I went into allergy immunology, though, I really realized how much I loved puzzles, and I fell in love with immunodeficiencies and understanding the immune system. It allowed me to really hone my teaching skills and be a very good teacher to not only my patients and their families, but I became a teacher to interns, residents, other fellows, other primary care physicians. And because of my experience as a mom and the journey I went through as a mom that I think we'll talk about in a few minutes, I kind of embraced the kids who were really chronically ill, whether it be with chronic asthma or whether it be something more severe like a primary immunodeficiency. So I feel very grateful for the opportunities that I've had throughout my career.
Yeah, I remember when I was in my nutrition and functional medicine training, the teacher kind of forced us to create explanations of how the immune system functions by telling little stories, right? So I think, and I'm sure as a doctor in the pediatric space, you have to do that as well to help our kids and the parents as well understand. What I love about the
Right.
immune system is it's so like it has to remember all the organisms that it has like been exposed to, and then it
Yes.
has to figure out how to defeat them and create a response. So it's really, I mean, imagine in a world filled with so many bad things that can harm us. Obviously some microbes are good, but and our body has the capacity to protect us like for years, and if we make it to 100, that's a remarkable feat. So there's so much fascination. It's always interesting what kind of in your brain makes you get really excited about being a doctor, but it's
Right.
interesting to hear yours as well. It's pretty interesting. So let's talk a little bit about the next thing that's on my mind, which is being a parent. And again, the intro kind of introduced this idea of, wow, it's like this miracle in front of you. And I don't know that I fully understood what it meant to be a parent, but I want to hear from you. Like when you think about this ideal of being a parent, what does that mean to you, and how would you frame that?
Yeah, so I had said that, when I was a kid, I had this like dream and aspiration of being a doctor. Well, I also had this dream and aspiration of being a mom. And had tons of dolls that I would uh, play with as if they were my own children. So I had this innate, like, motherly instinct, and really, being a mom was like this huge dream to me. And having my first child, like you described in the intro, it was an incredible thing because I had the privilege and honor of like carrying this life for 9 months and then like giving birth to this life that at the time, the world was their oyster.
Mhm.
And to be in that situation where you are so privileged to have an influence on somebody's life in such an intimate way is just an undescribable thing.
Wow, very well articulated, and for those who are not parents, I hope that resonates with you. For those who are parents, I hope that resonates with you. And I think pausing and just reflecting on that gift, even recently, my 26-year-old had a interview for a job, and even at that age, we're still mentoring and coaching, and hey, let's think about how you're gonna interact with the during the interview, and it's like it never ends. It's constant. And who knew that that moment of having fun with your partner turns into such a great a life experience, not only for you but for everybody involved. So thank you for sharing that. And so let's talk a little bit now about this life before you discovered your child had a medical condition. I guess it's like you had this dream and then you had your reality. So before we get to the things that challenged you guys, what the things kind of turn out the way you expected? What was that whole before the illness life like for you?
Yeah, so that's an interesting question because when I had my first child, I was a pediatric intern, and it was before the duty hour rules. So,
Mhm,
for your listeners who aren't physicians or don't know about duty hours, during my internship, it
mm,
was easy to work 120 hours in a week.
mhm,
Easy. And so I was busy when I was an intern, and then during my residency, like it still was very busy. And um, I enjoyed the time with my oldest, who was a toddler, but um, it was those moments of enjoying him were, smattered in with working a lot and being
mhm,
super tired. Um,
mhm,
my daughter, my second born, came when I was in my third year of pediatric residency. So, you know, I loved being a mom, but life was not like roses and unicorns
mm,
before she got sick. And because the um, the story of my daughter really began when I was a third year resident, and she was diagnosed with neuroblastoma, which, as you know, but your audience may not, is a type of pediatric cancer.
mhm,
And my world came crashing down when I got told that. And I had taken care of lots of patients that had had that. So
mhm,
I knew what that meant, and I knew what complications could come from it. So life before her diagnosis was crazy,
mhm,
but it was crazy because work life was crazy. When
mm,
she got sick, my world became crazy because I was overwhelmed with worry, with guilt, with fear.
mhm,
Um, and I, kind of went into a dark place at that time. With time, things got better. Um, and she went through surgery and chemo and the whole works. And, as we got farther away from the diagnosis, I could feel those emotions kind of lifting, but they never fully went away.
Mm-hmm.
When she was 12, I got to have the honor of being the physician who diagnosed her with type 1 diabetes. And once again, like, my world came crashing down in
Mm,
that moment. And it was this realization that I needed to take care of her, but I also really needed to take care of myself because
mm-hmm.
I didn't want to go back into that, like, really dark time when she was sick as an infant. That wanted to take kind of steps to be more proactive about making sure that I was taking care of myself along with taking care of my family.
Mm. Well, that's a lot to have to swallow. I think a diagnosis of a cancer is very frightening for anybody, but when you think about our babies, that's even more challenging. And I know that having a wife with type 1 diabetes, and her being a pharmacist, it was again that awareness of what this meant that makes it worse. It's almost better not to know what you know. And she knew in that moment she would have to manage her life in such a way that is different than before that. I live in this kind of low carb space, and so we're familiar with authors like Dr. Bernstein of the
Mhm.
Diabetes Solution, Type 1 Grit Facebook group. So I'm curious, when you were facing the challenge of taking care of a baby with type 1 diabetes and having training that generally doesn't think about nutrition the way we may think about it now. What resources did you have to help you support a child with type 1 diabetes? Was it that type of information I just shared, or was there other resources?
Yeah, so, I will say first, I'll make a comment on something that you said about how your wife kind of knew what that meant. And I too, each time that I was presented with a health challenge with my daughter, like, I immediately knew what that meant. And
Mm,
so some folks have said, well, it must have been easier because you knew what it meant. And I have always explained that there's not an easy way.
hmm.
There's difficulties and challenges with knowledge, and then, like, the knowledge your wife had, the knowledge that I had is very challenging because what could happen. Um, it's also incredibly challenging to be naive about what is going to go on because you live in a space of I I don't know what to expect,
Right.
and so it's constant fear about an unknown thing. So there's not an easy way. Both sides are tough. But,
Yep.
back to your question about resources, I always tell people you have to find your people
Mm,
because support during times of challenges is so critical. Um, I really, got involved with JDRF, Juvenile Diabetes Research Foundation. JDRF does a lot with support and fundraising
mhm,
for type
mhm,
1 diabetics and their families. And so finding um, families that you can talk to and share
mhm.
tips with, or share challenges with, or learn from is so important anytime you're going through a challenge.
Yeah, thank you for that because and I think that is so important. Again, the tips, the inspiration, this is not that bad. Life is still pretty good. All of those types of things that you can learn being in a support group is so important. So thank you for that. It also requires, having taking a peek at your book, you talked a little bit about being resilient. And I do think it's important when we're facing challenges that we are resilient. So I want you to share some of the lessons that you would want the audience to know about the importance of resilience, because I know that's part of what you like to teach.
Yeah, of course. When we're faced with a challenge, we really have two choices. We could either allow life to happen to us and crumple up in a corner and
Mhm.
pretend like it's going to go away, or if we're faced with a challenge, we could have life happen for us and learn from it and grow and allow that challenge to really be a gift. And, that choice is really part of resiliency. I oftentimes teach about the four C's that are really kind of the foundation of being able to make that choice of, are you gonna shrink in a corner, are you gonna turn this into a gift? And that kind of first C is consciousness. So our brain, as you know, is an incredible tool, but it's constantly giving us lots of different thoughts, and many we're not even aware of, that we let all of these thoughts kind of go by and they become beliefs, but we act on these beliefs, but we're not even cognizant of what thoughts our brain is giving us.
Mhm.
Our thoughts are so important to be aware of because they are the thing that drives our emotions, and our emotions drive our actions. So, if you really want some result in your life, then it's really going back to what thoughts are going to give you the right emotions that are going to create those actions that will lead to the results that you desire.
Mm.
So, consciousness, without a doubt, is the very first step in becoming resilient. So, being aware of what thoughts that your brain is offering you. The That leads to the next C. Um, the and before I leave consciousness, I should say, a lot of people say, like, well, how do you become conscious of your thoughts? I often recommend journaling because journaling allows that space to get the things that we have on our mind out on paper, and we can objectively look at them. So consciousness is first. The second C is curiosity. Curiosity, what I mean by that is being objective and looking at those thoughts and saying, are those thoughts the thoughts that I want to keep because they're serving me? Or do I want to let them go because they're not creating the emotions that I need in my life?
Mhm.
So curiosity is super important. And then once you answer that question on, is it serving me or not, it leads to the next two C's, which is commitment and courage. And it's commitment and courage to pick the thoughts that do serve you and commit to being able to change your thoughts so that you're creating emotions in your life that are driving positive actions that are giving you the results that you want.
Very, very nice. I like that. When I think about my nest and my T is focused on how we think. Of course, it also addresses recovering from trauma. But if our consciousness is something we focus on, we create awareness of it, maybe by journaling and other ways. It just reminds us that our thoughts matter. And my rope acronym talks about emotions, and our emotions matter. So I'm trying to connect the dots because a lot of times people say, why is it that this person, Dr. Hampton, is low carb doc? Why just tell me about low carb? No, we can't just talk about low carb. We have to
Right?
talk about these other things, because if you have self-limiting beliefs that are not allowing you to maybe make lifestyle changes, then you're going to struggle. And I just love that idea of, let's think about our thoughts. Let's be curious about our thoughts. Let's commit to them. Let's have courage. All of these things make sense, because when you struggle, it may be your thoughts that are the biggest barriers. So thanks for having that as part of what you teach, because without that, I think people would not find their way to their goals. Um, now, when you're working with young people, it's important that we recognize that um, they may be in an environment where they may not have everybody in that environment supporting them, and it may require a parent to step in and advocate for them. But the world is a little messy, it's a little scary. People are trying to give you advice, do it this way, do it that way. So as a parent, I know it's important that we support our kids and advocate for them. But so why do you think parents really need to understand the importance of that?
Well, uh, I would say parents really need to understand the importance of advocacy for kind of two reasons. One is that if they become really good advocates for their child when their child is young, their kid's going to get better care in the healthcare provider's office and in the schools. So you make a better environment for the child. But the
Mm,
second reason that parents need to be good advocates is because as a parent, your role is to teach your child. And
mm.
parents oftentimes think that teaching them is just by words, that they're going to teach them like a lecture something. But really, kids learn the most when they're watching their parents. And this comes back to advocacy, that I can tell you, my daughter, she can stand up for herself now as a young adult because she has watched me advocate for her when she was a young child. And doing that, and I wasn't perfect every time, but learning from my mistakes and getting better at it as time went on, she has now like continued that journey of advocacy and does really well with advocating for herself. So creating the adults that we want in the world is really why parents have to get good at it.
Yeah, and it's kind of nice to think about it in terms of what's going to be your like first kind of default reaction. Is my default reaction is to be hesitant and not speak out when it's appropriate, or is my default is to always kind of lean towards speaking out? I remember when this is a unrelated subject, but I remember when I used to be at conferences or maybe in a meeting, and I would always my default used to be to don't say anything, be quiet. I don't want to mess up. Now my default is to say something fairly quickly. So I think you have to train your brain to do this advocacy by, obviously you have to remove the fear of, doing that. But I think that as a parent, man, if you're not going to advocate for them, then who, right? So
Yeah.
that's,
Well, and so will point out to you, it all comes back to good work on your mind, right?
mhm.
Because what you said about like you used to be quiet and not speak up. Well, it goes back to that was your action because you were trying to avoid an emotion that came from a thought. So, really being aware of your thoughts again is the basis of how to be better at advocating. And, I've had patients who have said, like, "Oh, you talk to me about advocacy, but you're a doctor. Like, you know how to advocate for
Mhm.
your kid." And I will share with you a quick story. When my daughter got diagnosed with type 1 diabetes, we were in a tiny school bathroom. I thought she had a urinary tract infection and had brought to her school a urine cup and a dipstick,
Mm.
so that I could diagnose her UTI in the school bathroom so that we wouldn't have to go all the way home to get antibiotics or something to treat her with it. So we're in this small school bathroom. I realize when I dip her urine, she has diabetes. We head off to the emergency room. And we get to the emergency room. The ER doctor comes and I explain to him, "Hey, look, I'm a doctor. I dipped her urine. She's got a lot of sugar in her urine. She has all the symptoms of diabetes, that she's got type 1 diabetes." And he says, "Well, um, we're going to get an x-ray." And so I said, "An x-ray?" And he
That's
said,
odd.
"Yeah, I want to make sure she doesn't have pneumonia." And I was like, huh? That,
Hmm.
and in my mind, I'm thinking, I didn't say anything about a cough. I didn't say
Mhm.
anything about shortness of breath or a fever. So there's nothing that would have said she had pneumonia. But, and in my mind, I also reflected back on her cancer therapy as a young kid and how much exposure she has had to radiation through her life,
Mhm.
and knew this was my moment, that I needed to protect my child and advocate for her
Mhm.
so that she wouldn't have to get an unnecessary chest x-ray. Um, but at the same time, in my mind was, this is a colleague that I'm going to have to work with in the future. If he wants a chest x-ray, I'll just go along with the chest x-ray.
Mhm.
And we got a chest x-ray. Lo and behold, she did not have pneumonia. She had diabetes. And
Mm.
but I beat myself up about not standing up for my kid in that moment, because it was a thought that I needed to please this other individual.
Mm.
So I was avoiding this discomfort of asking for another opinion about the need for a chest x ray. And um, I learned from that experience and have since, like, let it go and know that, in life, we do lots of things that we fail at some of the time.
Mm.
And failure is not necessarily a negative thing, that it's just data to tell us how to do something differently next time. And so I certainly have learned about how to advocate for my kid better than that scenario. But doctors are not immune to the
Mm-mm.
need to learn how to be a courageous advocate. And patients are potentially a leg ahead of us sometimes on advocating.
Yeah, well, I can guarantee you that's true. I've seen some very strong advocates in my clinical practice. In fact, one of the last patients I saw today, they came in for a mobility evaluation for a scooter, and the two kids who were there were very, very adamant about making sure that that process goes well, because they understood that if you do a mobility evaluation for a scooter or motorized wheelchair, if you don't dot your I's and cross your T's, things won't go well. So they were very helpful in terms of making sure that I documented the right things and made sure. So, yeah, you have to be that way. And what I'm hearing from you is that failure can actually be the thing that'll make you even better at this, because you're not trying to fail again, because you've been through that, and the emotions of what that felt like actually will make you better. And then it sounds like you have to practice. So the more you practice advocating, the better you'll get at it, because you've had a chance to kind of hone your skills. So, but man, let me tell you, all of this, thinking about the cancer, thinking about this idea of type 1 diabetes, or even just learning how to be better at parenting, all sounds fairly overwhelming, particularly if you have a sick child. It's hard enough to raise a kid who's not dealing with a medical issue. So share some thoughts about, no pun intended, but share some thoughts about not feeling overwhelmed when you're faced with these challenges.
Yeah, I will say when I walk into a super messy room, I can immediately feel the sensation of like being overwhelmed, right?
Hmm.
That overwhelm is an emotion that will create this vibration in our body. And I can feel that stress from seeing this messy room.
Mm.
And the reason I explain that is being overwhelmed with your child's diagnosis, or work stress, or family stress, or whatever it is that's causing overwhelm. It goes back to you have to get organized. And it's organization with your mind is at the top of the list of things that need to get organized. And what I mean is going back to like what we were talking about earlier with journaling and being aware of what
Mhm.
thoughts are there, that oftentimes the overwhelm comes from thoughts about what could happen in the future. Well, when you realize, hey, these I'm writing down like this thought keeps coming up when I journal every day, and it's not even happening. That you can give yourself permission to let it go, just like organizing your closet and letting go of clothes that don't fit. That organization really helps with being overwhelmed. Now, the thing I will say though that I want to make it very clear is being overwhelmed is a normal emotion when you
Mm.
are faced with some big challenge in your life. And I'm not here to say you should never feel overwhelmed. What what I'm trying to say by explaining the process of organizing your thoughts is that I don't want people to live in a constant state of being overwhelmed. It's kind of like if you put your hand on a stove, that that hot heat you want to feel because it allows you to pull your hand off the stove. You don't want to keep it on the stove. And same deal goes with being overwhelmed. You're gonna feel that initially. Like when I got the diagnosis of neuroblastoma in my daughter, or type 1 diabetes in the school bathroom. Of course, I'm gonna be overwhelmed. But living in a state of overwhelm for months or years later is unnecessary. And we can take steps to make it so that we don't have to live that way.
Yeah, I love this concept of organizing thoughts, and I I really think that's so important. And when I think about it though, when I think about my own life, I think about having someone to support that. So rather it's a therapist for a relationship, a leadership coach, and even listening to, I feel like we're getting some coaching as we're having this conversation. I think it's important that people realize that they don't have to figure this stuff out on their own. There may be some resources out there. So what's been your experience with this idea of getting coached as we kind of take life's journey?
Yeah, well, I will tell you that I applaud you and your work and doing, putting the podcast out there because, like we were saying earlier, listening and sharing stories has a lot of learning that we can give others. And I used podcasts when Kylie was diagnosed with diabetes. I consume tons of life coaching podcasts to
Hmm.
help me prevent the negative mind space that I was in
Mm.
years earlier. So I learned a lot from there. I then went on and had my own coaching done. I later became a certified life coach, not because I anticipated sharing the tools of life coaching with others. I became a certified life coach because I had a leadership role in the hospital where I was mentoring program directors and residents and fellows. And I wanted to learn more to help me in my mentorship role. So became a certified life coach because of that, but quickly learned that the tools I learned in coaching helped my patients in clinic. And what a blessing that was.
Hmm.
And then I was able to help my patients in a different way by uh, being a life coach for them. So, not doing medical care for some of them, and using my experience and journey as a mom as part of that and blend that knowledge to be able to share with them so that their journey could be a little bit easier than the one that I went through.
Yeah, I in my leadership roles and with Advocate Health, and by the way, Advocate Health is now part of Atrium. And as you know, Atrium is in your neck of the woods. So we're in North South Carolina, Georgia, Alabama, Illinois, and Wisconsin. So I hope my patients don't hear this, but if I end up in Carolina one day, you'll know why. So just saying, just saying. But it's
It's
warmer there.
beautiful. It's beautiful.
I know. Just saying. All my patients checking this out, ignore what I just said. But having said that, with Toyota, I did some of those lean principles from the Toyota Motor
Yep.
Company, and they talk about you have to not only coach others, but you need to be coached. So even the coaches need to be coached,
Oh,
and
for
it
sure.
fine tunes your skills.
Yeah.
It just fine tunes it, and I think you have to get it from both ends. And the more you do it, the better you become. So I appreciate those sentiments as well. So we've touched on principles, many of which I'm sure are in your book, Reclaiming Life: A Guide for Parents of Chronically Ill Children. And and I'll say this out loud: so many principles that we're sharing are not just about dealing with chronically ill children. Like, you can apply these principles in life in general. So for those who are checking out this episode and they're intrigued by this conversation and you want to think about the book, think broader, because even the Toyota lean principles that I learned, I applied them at home. Like, how can I be more efficient? Let me get an example. So I learned from Toyota that, let's just say I'm making a nice keto friendly rib rub, right? And I got the recipe together, and I make this great rub. Everybody loves it. But then the next time I do it, I have to go through that whole process again. So what they teach is, what you just make enough, a big batch of it, so you won't have to do that process again. So they teach you how to be efficient and think in those terms. And that's kind of what's cool about, learning principles. You take the principles and you apply it Rather, we're talking about, this coaching model, et cetera. So let's talk about, we've touched on some things, but if somebody picked up your book, Reclaiming Life, how is it framed, and what would they learn as they kind of walk through that book?
So I will say right up front, what you just said about the example and how you can apply it anywhere, it is so true. And one of my very good friends is not married, has no kids, and knew he was going to have to read this book when I put my book out,
Right.
right? And he kind of dragged his feet on, reading it. And then he finally sat down and read it. And he called me up and he's like, I just want to apologize to you. I am so grateful that you wrote this book, because even me, as somebody who uh, does not have children, who does not e- ever have the desire to be a father, that
Mhm.
this book still has lessons and tips that
Yeah.
I can use in my life, and I appreciate you for writing it. So
Nice.
the book started as a kind of historical thing for my kids, because my kids would always ask, like, hey mom, tell us a story about this, or tell us a story about that. Well, I sat down to write the book and quickly realized that our stories of what happened to my daughter when she was an infant, what happened when she had diabetes, the could be used to help other people, because just like what we're talking about with podcasts and listening to other people's stories, that we can learn from each other. And so the book now, the finished version of the book, is on Amazon, and it each chapter deals with a different topic that has a story about my daughter as an infant, a story about my daughter as a diabetic, and a story of a patient of mine that I've taken care of, along with lessons and tips that the reader can start putting into their life the day that they read the book. Um, and it is very, even though it's filled with stories about kids, very applicable, like I said, and like my friend figured out, to individuals who don't even have kids.
Yeah, thank you for that. And I kind of know that intuitively because I always walk away from lessons learned, and I always try to figure out how to apply them. And it's nice, but these concepts we're talking about are just logical things that you can apply in all aspects of your life. And so we've talked a little bit about the feeling of being overwhelmed, and I think some of that's particularly for the ladies. Shout out to all the ladies who are managing so many things, and now as a man, I can say that with a straight face. um, but then sometimes people are being superhuman or attempting to be. So I think part of being feeling overwhelmed is that you're trying to do too much. So what's your advice for people out there who, even after hearing this conversation, they leave it and then they go back to their, superhuman mindset? What advice would you give them?
So I will say, I wouldn't tell them to stop being superhuman. I would tell them, continue to strive to be a superhuman, but but give yourself grace when it
Hmm.
doesn't work out in your favor.
Cool.
And what I mean by that is, uh, I'm somebody big who loves goals, and setting impossible goals is very important, because it's kind of like the compass in our lives. So I equate trying to be superhuman with trying to achieve an impossible goal. But it goes back to what we were talking about earlier with failure. And when things fail, it's okay. All that's telling us is information on how to do it differently next time. We certainly need to prioritize self care in our everyday routine as part of that. So, being a superhuman doesn't mean that you're not taking care of yourself. And I think it's even more important when you're a parent and a parent of a chronically ill child, because parents often feel guilty if they take a few minutes for themselves. I teach parents, no, 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 stop feeling guilty. This is a necessity so that you can be the super parent that you want to be. It's not a luxury to just take a few minutes to meditate or take a few minutes to journal or collect your thoughts or do some deep breathing or whatever it is to kind of relax. That is a necessity, not a luxury.
Absolutely, totally agree with that, and I love the way you framed that. I think that's important to kind of frame it that way. And as we kind of get close to the end here, one thing I noticed in your bio was that you had some veteran experience, and I have so much respect for those who have served our country. And but I'm curious, has that experience impacted how you approach the lessons we've talked about today, or just life in general? I'm just curious how you've integrated your experience as a veteran into this conversation.
Oh, absolutely. I had started the conversation with saying that I had just moved to North Carolina in May. So, May 31st of this year, I retired from 29 years of active duty service in the Army.
Wow.
And during that time, deployed overseas, was a physician in Iraq during the war. So, yeah, like
Hmm.
I I approach it very similar to what we're talking about, and it is one of those challenges that I have chosen to turn into a gift. That I look at all of those opportunities that I had to take care of our wounded warriors and their family members, and I feel incredibly humble and honored by the responsibility that I had for doing that. But I also learned a great deal about teamwork and how important having a good team is. And then, uh, you know, I also learned about how important physical activity is, because as part of being in the military, every 6 months you get a physical fitness test that you had to do. And so, knowing that that is part of your job, and it becomes a priority. But we should all, regardless of if we're in the military or not, make physical activity a priority, because it not only helps with our physical health, it is proven to help with mental health too. So I think I've, you know, I'm very grateful for my time in the military. And when folks say, like, thank you for your service, that I almost feel a little uh, odd when they say that, because I feel like I have learned so much from the military that I
Hmm.
wouldn't have changed it for the world.
Well, I appreciate your humble statement. But for those who are checking out this episode, we're going to continue to say thank you for your service. Thank you for your years of sacrifice. You blew my mind when you suggested how many years that you have served. Thank you for helping to protect us. Thank you for defending our rights, the rights that we sometimes take for granted. But I'm just so thankful that we have people on the planet who have dedicated a large portion of your life in serving. So thank you again. And I'm so happy you've received a gift from it as well. So that's
Yes.
really good to hear. So as we wrap up, I always ask my guests, what are they going to do to help protect their nest in the future? Rather it's, nutrition, exercise, less stress, more sleep, our thoughts, recovering from trauma. And my rope speaks to making sure we have relationships that serve us, having avoiding organisms and pollutants that can harm us, and of course, protecting our emotions, which we talked about a little bit today, and making sure our life experiences serve us. So, how are you looking towards the next 12 months when it comes to that?
So I have already told you that I am like super big on goals. So, New Year's Day is like one of my favorite days because I get to, sit down and really reflect on the previous year and like have
Yeah.
a new slate of goals. But you asked about what am I going to focus on in this? And in thinking about that, it's almost like trying to say who your favorite child is, right?
Mm,
That I I love the work that you do because I think all of these are very important to spend time working on and
hmm
reflecting. I have very big goals when it comes to nutrition and exercise. I also have very big goals when it comes to emotion work, because that's where I spend the majority of my days in trying to help other people. And like we were talking about earlier, you can't be 100% to when you're trying to help someone if you're not 100% yourself. So I think those are two big ones that are on my list. But quite honestly, they're all there
That's
somewhere.
right.
Yes.
Absolutely, and that's a fair statement, and I agree. Even for a guy who focuses on nutrition, I'm always tweaking my diet, trying to figure out how to make it more interesting, but more importantly, the diet that makes my body the happiest. So I'm always
Right.
listening for those body cues. So I really enjoyed our conversation. I do believe that you are a gift to the world, and that you're not just here, but you're spending some time on the planet, making it better than it was before you got here. So thank you so much. Let's make sure those who checked out this episode know how to get access to your resources and your book. So what would you say?
So definitely check out my website, which is maureenmichellemd.com. Michelle spelt with one L. I'm also on Instagram and TikTok as Maureen Michelle MD. My book, Reclaiming Life, is on Amazon. So I would love for your listeners to check it out. I am so appreciative to be here. This was a great conversation.
Absolutely. I enjoyed it as well. And I'm looking forward to more conversations in the future. And again, I want to do a shout out to your daughter in particular for allowing us to hear her story, and just the rest of your crew for just helping you to supporting you through this journey as well. So thank you so much for being a guest on the podcast today. I appreciate you.
Absolutely. Thank you so much.
And guys, I think today we had a blessing. Dr. Maureen was able to share her perspective, and and for those who joined us today, whether you are raising children or not, we just learned it didn't really matter. My hope is that we all now have additional tools in our toolkit to help us navigate whenever we are faced with what I feel are inevitable challenges that always seem to come our way. I'm so happy that when we face these challenges, we now have a way to overcome it. So I really appreciate the doc taking the time to have a clinical practice, coaching, and of course, a great book to help guide us along our way. So for those who check this out, I know your time is precious, so I appreciate you spending time with us. If you found anything in this episode intriguing or interesting, or you just want to share in the podcast comments and the video notes, just make some share some thoughts, because we are all kind of working together to help the world heal. So we need to hear from you, because you may provide a perspective that we didn't even talk about today, but you can share that in the comments. So, but again, thank you for your time. Thank you for having faith in this platform. And until we meet again, continue to be safe, be well, and continue to protect your nest. And thanks again, Doc, for being here.
Thank you.
You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.